Alright, this is the hip, phase 1. First is H10, this is the hamstring stretch. So you kind of keep the patient, kind of put their hands on their hips, one foot will be out, kind of bring the toe towards them. So good posture, and we're just going to lean forward. Should feel that stretch behind the knee into the hip. Oftentimes patients will kind of shrug their shoulders, they won't feel it until they get down real low. So we try to have good posture all the way through. 20 seconds, working away to 30 seconds, 3 on each side. At the hamstring stretch. Also included in H10 we have the quad stretch. I'll stand up for this one. If the patient can, just have them grab the back of the leg, use something to hold on to if they need to. Legs in a straight line, it's not out to the side. Hold that, 20, 30 seconds. You can also have the patient lay prone, strap a strap around their ankle, kind of have it in their hand here. You might have done this before in the other offices. Have them sit here and kind of pull the strap down. So really stretching the front of that quad muscle right there. So again, have that strap and you're just going to pull it down. Just like that. Another way to do the quad stretch. Next, I'm going to stand up here and use this chair for the hip flexor stretch. The main way we're going to demonstrate this one is at the right leg's affected, the left leg would be up on the step. Toes are pointed straight, hands are kind of on the hips. You're going to lean into the chair, lean back just a little bit. You're going to feel that hip flexor stretch right through here. So again, if they're leaning forward, they won't feel as much. When they start to lean back, they'll get the full effect of the hip flexor stretch. Demonstrate on the right side. So we're going to stretch the left side here. Lean into it, lean back a little bit. You should feel that stretch. Hip flexor. We've got all 3 of H10 there. Next we have the H11, which is the vault board. I'll be standing for this one. Again, this is phase 1, so we're just having the patient forward and backwards, slow and controlled. Have them pause for a second or two in the middle if they can. Again, twist the board. So they can go side to sides. Nice and slow and controlled. Balance in the middle if they can. That is H11. Next is H12, which is just the basic single leg balance. Using something to hold to if they need to. Hold in that position, good posture, body straight up and down. 10 second, work your way to 15 seconds. Alternating the legs. Next we have H13. These are done at the table here. These are called supine fallouts. Have the patient laying supine. Knees are bent. Feet are kind of shoulder width apart. These are called fallouts, so one leg. Just gonna let the hip kind of fall out a little bit. Slow, controlled. Have them hold there for a second or two, then slowly bring it back up. Again, stomach's tight during these exercises. Let the patient hold their breath, slow, control. If they're in a lot of pain, they'll probably feel this pretty good. So that was the supine fallouts, just letting the leg kind of fall out, alternating back and forth. Next, we just have the straight leg raises. Knees bent, toes towards them. That really engages the quad muscle there and hip flexor. Just keep them, raise the leg straight. Raise it as high as the opposite knee, don't go higher. Try not to go lower, just even with the opposite leg. So that would indicate flexion. We would do abduction also. We advance the patient to these, so legs straight, going straight up. Try not to let their hip rock backward, try not to let the hip rock forward. Try to keep it in a straight line, just going straight up. We don't want pain, so right before the point of pain. And then we have extension. Laying on the stomach. Extending that leg up. Slow control, not rocking the hips too much. And we also have a deduction. You cross the leg in front. That's a deduction there. Again, their hips not rolling back, rolling all the way forward, just in a straight line. And then we have the clamshell, which is H15. Knees are bent side to side. Base of the ears opening up and closing. Nice and slow, controlled. Next we have H16, which is the adductor ball squeeze. Here instead of a ball, I'm just going to use a bolster. Placing the ball in between their knees, feet are together. I'm just going to squeeze, hold for 5 seconds, relax, 5 seconds, relax. Next we have the double leg bridge. Everyone's familiar with. Feet are kind of shoulder width apart, just for starters. Straight up, hold for 3 to 5 seconds, relax. Make it harder, put the feet together. Make sure the body's in a straight line, and relax. Next we have the standing TFL stretch. So first, we're going to cross one leg in front of the other. We're going to stretch the left leg, so whatever leg's behind is the leg you're stretching. You're just going to bend forward, kind of almost let your hip rock to one side, bend down. You should feel that stretch down through here. Hold that stretch for about 20 seconds. And if you want to stretch the other side, do the right leg, cross the left over top, and forward. You really stretch this side over here. So that's the TFL stretch. H19 would be standing hip, abduction, flexion, extension. So you can have them hold on to maybe the back of a chair or something. So they're just doing basic hip flexion. Have them do some abduction onto the side. Just make sure they're not really rocking their hips. That defeats the purpose there. And then we have some extension. So strapping down, legs going back. The body's not coming forward. All hip extension there. And that concludes phase 1 of the hip.